Our Dilwalk Do It for Life campaign kickoff. Woohoo! Very excited. I'm Leela here, and we want your hearts to beat fast and strong and steady for years. And with that, I would like to start us off with a land acknowledgement before we get started. We acknowledge that we are gathered today on the traditional lands of the Indigenous peoples who have cared for this land for countless generations. This is Treaty 7 territory, the ancestral home of the Blackfoot Confederacy, including Siksika, Piikani, and Kainai Nation, as well as the Tsuut'ina and Nakota Nations, which include Wesley, Chiniki, Bearspaw. We also recognize that this region is home to Métis Nation of Alberta, Region 3.
Great. Well, thank you. Thank you so much for having me here, and thank you to everyone for being here today. My name is Ellen Parker, and I'm good friends with the Dilwalk campaign team and really excited to facilitate the panel. So thank you. And before we get started, I just would like to take a moment to welcome and introduce each of our friends here up on stage with me. So Alina, welcome. Thank you so much. We have Alina Semenenko, who has a Bachelor's of Science in Honors, and she's the campaign project manager for Dilwalk. Welcome. Raman Kapoor, our registered dietitian and the president of Dilwalk Foundation. Welcome and thank you. We have Elizabeth Hanau, the participant of the Do It for Life campaign, here to speak about her experience and the benefits for all of us. So thank you so much for being here, Elizabeth. And Elizabeth is also the CFO of St. Patrick, which is a really interesting organization, and she will share a little bit more about that with us on today's panel. And then we also have Noman at the end, and he is our nurse practitioner for the Dilwalk Foundation, who will speak about his role and the nurse practitioner's role in this to ensure everybody has a truly magnificent and actionable experience when they are participating in this campaign. So welcome, thank you for being here. So my first question is going to be to Raman. Welcome, Raman, thank you. So Raman, tell us a little bit about Dilwalk, when it was founded, and why you've launched the campaign that we're here to celebrate today.
Absolutely. Thank you so much for being here, and thank you to everybody for being here today too. So the Dilwalk Foundation was a foundation that launched back in 2013, and it was really to help focus on prevention and the management of chronic disease. It was to look at empowering individuals to see if we could give them the knowledge and the access and the ability to better control their health. So if you actually look at Dil means heart in Hindi, Urdu, and Punjabi, and it's an acronym for Do It for Longevity. And the word walk means it's also an acronym for wellness, access, linkages, and knowledge. So ultimately it was to build capacity in the community to look at more grassroots initiatives to help people get a better handle on their individual health.
Okay, excellent, thank you. Now I'm going to ask Noman if you could sort of talk a little bit about how this campaign is actionable and what specifically you're doing as a registered nurse, and how this can be translated for the broader community.
Sure. So one of the main important parts about this campaign is that hypertension is a silent disease. Most often than not, people that have high blood pressure don't have any symptoms. And so this campaign is really important in really targeting those patients and those people that don't know that they have high blood pressure. And one way to really make this campaign actionable is the fact that our campaign is very different than, for example, going to just your pharmacy or your family doctor to get a blood pressure taken. Those blood pressure numbers are very snapshot images of what your blood pressure is doing in that moment of time. When we do this 24-hour blood pressure, we're getting an analysis of your blood pressure throughout a 24-hour period. That really gives us a good idea of how your blood pressure is over a 24-hour period. Is your blood pressure really high? What is your trends like? Because we know the trend of a blood pressure is very important. When you sleep, your blood pressure should go down to a certain extent. So these are trends that we monitor with the 24-hour blood pressure as well. Now, my role as a nurse practitioner in this team is really to bridge the gap between the specialists that are analyzing the 24-hour report as well as the patient. So I will be the one really discussing with the patients more closely about their results, what they should do, what they should work on in terms of managing their blood pressure, as well as what they need to do for future longevity and really reduce risks of having high blood pressure if that's the case.
Okay, excellent. So it sounds like you're wearing a device to monitor your blood pressure. That's what's happening.
Correct. So the blood pressure monitor is a monitor that was provided by BioAero. It's a monitor that is traditionally worn just with a traditional blood pressure cuff that you wear on your bicep. And the monitor will monitor your blood pressure over a 24-hour period. It will monitor every half an hour during the day and every hour over at night. In your daily living. So you're going to be doing everything that you do on a normal day, whether it's cooking, working, going to the gym, whatever that is that you do. And we take a look at what your blood pressures are doing again, as I said, as a trend throughout the day on your daily living.
Okay, interesting. And so what sort of time frame are you participating in this to get this sort of data?
So the campaign is, there's no specific time frame per se, but our campaign, the target of our campaign is to target 100,000 Albertans through our period of time when we start this. So that's trying to help as many patients as possible, as many people, as many Albertans as possible throughout the province.
Okay, excellent. And so anybody, any organization, community can participate in this?
Correct. So anyone over the age of 16 can participate in this. It's really important to note that blood pressure, high blood pressure can affect anyone. It's not, there's a misnomer that, hypertension or high blood pressure affects old people. Not necessarily true. Anyone can be affected by high blood pressure. So really anyone above the age of 16 can participate in this.
Ah, very interesting. So now over to Alina, who's helping with the campaign. Let's talk a little bit about what kind of organizations, what kinds of people in the community would really benefit from this.
I would like to ask everyone in a simple question. So from now to the treatment, how long does it take? Like, let's say that in a best case scenario, we decided to take time off work, go to the GP, get to the waiting room, wait for 30 minutes, and then wait for the 15 minutes of the consultation. In the best case scenario, the GP will have the ambulatory blood pressure monitor, but they tend to not. Not all of the practices have the devices on board, right? So let's say you have the device and you got the device. Now you wear it for 24 hours. You again need to drop the device at your own personal time. Now after the personal time, you drop the device and you need to book a follow-up appointment, again drive, again take time from your family, from your work, and then get back to the GP, get your appointment done, and it will take roughly about 2 hours. Let's talk about numbers because everyone hates it. So if we will have 5 million Canadians, or 5 million Albertans overall, to address with the blood pressure crisis, with accumulative, like let's say that all this procedure that we were talking about, GP will take 2 hours. In real life, it will take about 10 million hours to accomplish. And let's say with all of the capacity of Alberta and every GP would have the blood pressure monitor, right? It will take almost a year to address it for every Albertans. Not saying that it's in best case scenario that every GP will have the blood pressure monitor, and they will dedicate all of their time to addressing only blood pressure, which is very, very, very uncommon. So it will take about 10 years to fix every Albertan for the blood pressure. That's an incredible number, right? We would never think about it so from the childbirth till like your child goes to the middle school, this is how long it takes for Alberta to help you right now at the current state. Meanwhile, the Dill Walk can do it in, sorry for the technical issues, 1 month. You'll be asking where this time came from, because it takes about 5 minutes to address a patient because everything else is automated with the DILWalk. From the signing up the patient with the mobile device to getting to get the report, to get it reviewed by the cardiologist, to actually book an appointment with nurse practitioner and everything else. It starts with the 5 minutes. This is how much time we need to bring to the community. And addressing the question why we're talking to communities, to people, because without communities, we are no one. How can we, at our capacity, address 5 million people unless the communities themselves will take a charge of their health in their hands? This is why we can accomplish it in 1 month at our full capacity with the support from everyone in this room sitting here and acknowledging that, okay, we can do it. So thinking about this 5 minutes and why do we even need to do something like this? It's because the healthier the team, the better the results. Think about everyone who is coming to work struggling with the blood pressure, given that blood pressure is 1 in 4 people have it. So having a family of 4, my dad is affected. And I'm sure that every 4th person around you, just think about it. Why do you take chance of someone that you love, right? So we can bring this help. We can deliver it to the people. So healthier people, the better teams, better results, healthier communities, better communities, happier communities. So this is pretty much on why we deliver it to the foundations, companies, and everyone else.
Excellent, thank you. So yeah, in a nutshell, don't waste time. Get involved and make sure that the people that you care about are taken care of and healthy, because we've seen lots of data showing that current options aren't necessarily the quickest way to ensure our health and longevity. So let's talk about that, and let's speak with the amazing guest Elizabeth, who has participated in the campaign, and you have some very first-hand experience. So maybe let us know a little bit about yourself and your role as a CFO for your organization, and then your experience so far with the campaign.
Yes. Thank you for having us here. I'm so glad to be part of this project or this technology. And so my company is very interesting in the BPRO because this is going to bring so much, opportunities for people to check on your heart. So the only thing I can say is give a heart to your heart. Because we don't think about the heart, we just let it be, let it go, and don't be, worry about it. But it's not like a being worried about it. It's like a, try to be kind with humans being, because we are not the only ones in the world. So we need to go and, connect with the vision and mission, which is helping people with technology. And this is what we are doing, giving the people this opportunity. And we are part of Latin America, and we are going to bring this technology to Colombia to bring this opportunity of life and heart.
Thank you. Beautiful. Very well said. So I'm going to look back here to Alina now and let us know a little bit about how organizations and communities and individuals can participate.
Okay, I have one more slide in here. Are you ready? So the answer is that it's very simple. So starting with for the patients, if they want to participate, it starts with the online form that you can fill in on your phone, on the tablet, anywhere, on your computer to register. This information then goes to the electronic medical record system, just as any medical record system you have in a clinic around Alberta. And after that, you can get your blood pressure device from any location possible. Let's say that this location is your work or your, society or community center. So you pick it up, person assigns you to this, and then you wear it for 24 hours. After 24 hours, you just bring it back and receive your report. That's it. This is how simple it is. So I will address it from perspective of a different verticals, right? Because we are not only have patients in here, we have organizations, and I cannot stress enough that this campaign is free for organizations to participate in. You're gonna have support for your employees for a healthier well-being with no cost and no expense. It's just something that, I don't know, if I would be the person who can bring it, I would bring it definitely. So from the organizational perspectives, DILWalk provides the devices right at the spot. So all you need is just go to the DILWalk website and contact us. Or contact at manager@dilwalk.ca. Again, manager at dilwalk.ca. And we'll be in touch with you as soon as we can. Trust me, we're faster than you think. We are very, very, very interested in both participating and collaborating with different institutions and have you as our champions. For the volunteers, because there's another vertical to the patient, they're volunteers, right? The people who want to dedicate themselves to the communities, people who want to dedicate themselves to the community centers and actually provide these devices to the people around them. Again, dilwlk.ca, they'll do it for life campaign, and there is become a volunteer. We are welcoming all of the volunteers because those are the people who gonna deliver the help to the closest. They're gonna be the ones who gonna bring it to you and to make your loved ones healthier. So that will be pretty much it for the procedure part.
Great, thank you. So just some final questions here. I would like each of you please to tell me and tell our audience what the main takeaway is from your perspective. Or you could share one piece of information that you haven't shared yet. But what's an action item or a takeaway that you want the audience to know about the campaign and about the benefit?
So I think one of the main takeaways from this is not to delay. You know, this is when we can take more control, more power over our own health and have that knowledge about our health in our hands, we're able to be more actionable and able to actually make a difference within ourselves. I think the biggest takeaway for me is we need to shift our thinking from what we think we're practicing as healthcare, but it's actually disease care. We need to focus on healthcare, focusing on prevention, rather than going to the doctor, going to a medical facility when we're sick. Rather be empowered with the information and be more proactive.
Okay, so what we need to do is, like I say, we need to be, more wise about our heart because that's the motor of everything, and we need to take care of it. So we know. So we need to take the step to, again, enjoy this opportunity, which is very awesome.
Mm-hmm. Yeah, I think just further to your point, Elizabeth, we prioritize so many things in our lives these days. We're so busy with family, with work, with volunteer, taking care of our communities that we don't really think about ourselves. And we don't make our own health the first priority on our to-do list. And that will have tremendous impact, is what I'm hearing. And over to Noman.
I think one takeaway, key takeaway, is that empowerment is important. Education is important. Education is really the key to our own health. So one thing that you should actually take away is that spread the word. This campaign is really for everyone and anyone, again, above the age of 16. So do spread the word. We want all the Albertans as much as we can to really be participating in this campaign, and we can try to help out as many people as we can.
Can I just add one thing?
Yes, of
And
course.
that would be, one number is not enough. When we're looking at blood pressure, it's not about just one reading. It really is understanding what's happening in your daily life when you're out driving your kids, or you're eating dinner, or you're in a busy meeting, or you're working out at the gym, or you're gone to the park. When you're sleeping, it's those times that your blood pressure is having a true impact on your health. So for me, I think one of the other big takeaways, it's more than just one reading.
Excellent. Thank you. Thank you, everyone, for being here today. And I look forward to participating in the campaign and having all of
You
you
missed me.
participate. Oh, please share. Yes. Share your takeaway.
Yeah, because I've been preparing it. So
Okay.
I must
Okay,
share it if I
apologize.
prepared it.
Yeah.
I tried my best, so please. So my main takeaway is when we care, we prevent. And when we prevent, we save lives. And it will be a shame after listening to all of the great benefits that this panel spoke to the public to not even consider to take an action. So that will be my main takeaway.
Excellent. Thank you. Thank you, everyone.
Thank you so much to everyone for coming. This campaign is to be able to raise awareness, but we want to see 100,000 people actually look at their ambulatory blood pressure. This will change the way that we look at healthcare. It will also change the way that we perceive ourselves and the importance of understanding this information. Our entire family has done this, and it was amazing to actually receive that information. Please, please, please reach out to any of us if you're interested in the campaign. We're working with several organizations who are here in this room today, actually, who have taken it forward. We're so grateful to all of you who have started this in your organizations, and we're really excited to be able to share some of that information as we go forward. So this campaign is going to be the largest one in North America. So go Alberta. Let's see how we do. We're a get her done kind of province, so I fully expect that you'll be reaching out to all of us to get these machines into your systems and so that we can help you with your heart. Thank you so much. Thank you to the panel.